Okay, welcome back, everybody. We're going to go to our BECC um, themes panel. But first, we're going to have Sarah Holly, who's joining us, introduce herself and speak for a little bit. Thank you, Sarah.
Hi, Miss Lasherian. Good morning. I was going to say afternoon, but it's still morning. It's been a long morning. It's so great to be here. It's so great to see faces that I haven't seen in a long time, like Miss Hazel Tanner and other folks that I'm missing. And so I just want to thank Tamiko and her team, Lasherian and Amber, and many people for inviting me here into this space. I wish I could be here with you all day. and, and during the awards part of the day. But I just want to first off just thank you all for inviting me to be here, and for the amazing award as a BECC community partner. Even before my time at Ramsey County and as the director of St. Paul Ramsey County Public Health, I was introduced to this amazing collaborative of people that authentically engage our community and racial healing activities. And that's really focused on public health strategies to reduce inequities around birth outcomes. And so, I thought about BECC's vision of what you're trying to address, not only in community, but just across our system. And so, I think about how we're aiming to improve birth outcomes and how this collaborative has really centered the voice of community. And as I entered the Zoom room this morning and heard Jama Place and William Moore and TC talk about the role of fathers, I think it just speaks volumes of how important our voice is and how we all matter, is especially in reducing inequities in our birth outcomes. So I thank you for those words earlier, TC, Jama Place, and William Moore. BECC has really shown me how you have the power to affect change. And so, really focusing in on our US born and African born women and families and men who we're seeing some of the greatest birth inequities happening with, right? Infant mortality. And so I've had the honor and privilege of partnering with members of BECC through my radio show. So I'll take my Ramsey County hat off for a moment and just say that I'm the host of KMOJ's Know Your Options show. And I think over time, I think it started with Nina Harris and having her come on my show and talk about Club Mom. And I think Club Dad started at that point in time too. And Tamiko, your wisdom and leadership in this space, talking about what the vision of BECC is and the role of Club Mom and Club Dad. And so, I think the community engagement and outreach, particularly on KMOJ, around the importance of safe sleep. Lasherian and Michelle Chiesa were recently on the show talking about that, the ABCs of safe sleep, the importance of safe sleep, the roles of doulas, right? William Moore has come on and talked about his role as a doula and the role of fathers. And I think TC and Lasherian, you all, we've done a lot of engagement, particularly focused on the Black community and really talking about there are spaces for our parents in our community to come to through Club Mom and Club Dad. And so I so appreciate that. And, this past summer, Sharon and the team asked about doing birth announcements on KMOJ. And so I want to continue that. And I think it's important to lift up our families and the importance of families. And so today, later on today, BECC will be recognizing the importance of relationships and partnerships with so many amazing individuals. And St. Paul Ramsey County really appreciates your continued collaboration with BECC and the folks on this call and folks that aren't here. And so just in closing, I'd like to share a quote from the great author, professor, and feminist and social activist, Dr. Bell Hooks, that one of the most vital ways we can sustain ourselves is by building communities of resistance, places where we know we are not alone. And BECC has been a collaborative that builds communities and where we are not doing this work on our own. So thank you for having me. I'll try to stay on and listen in a little bit more. But I do appreciate, like I said, even before my time at Ramsey County, being a part of this work, not only at the state level, but at the county level and in community. So thanks for having me, and I hope you all have a wonderful day.
Yes, thank you so much, Sarah. And we're so glad you're here. So we're going to lead into our BECC Themes panel. So as you all know, our three themes are to get to birth equity is trainings, celebrations, and policies. So we have two people from each of those themes, two partners in each of those themes who will have about 10 minutes to share, what they're doing, what's going on, how BECC can partner and help with what they're doing and what's going on in their organization, and how everybody on this call, the community at large, can help with that. So we're going to start with celebrations, and I'll let Amber moderate that. I'll moderate training, and Cynthia will moderate policy.
Yes, thank you. I believe we're going to be doing questions after all of the panelists speak. For celebrations, we have Ms. Hazel Tanner, who is representing Minnesota Black Nurses Association. And then we have Sarah Brown, who is representing Proof Alliance. So if Ms. Hazel, you are ready, go ahead, and then we will pass it on to Sarah Brown.
Okay. Okay, I'm trying to figure out what my train of thought's going to be here for birth equity that we're sharing information on. I guess I've been a nurse in 1967. I was born and raised in New Orleans. My nursing training was at Dillard University in New Orleans. I got my master's at the U of M. But I guess the birth equity probably started back with my grandmother, who was kind of like a midwife. My mom, she used to help, and my mom even delivered a baby at our house when I was a teenager. But I've always wanted to be a nurse. So anyway, and most of my hospital experience was with like open heart patients, dialysis, and stuff like that. So, but back in probably in the 80s, I wanted to get out of taking care of people on the after end. I wanted to go more into prevention. So that's when I went to grad school in health promotion stuff. So long story short, after I graduated, got to become a public health nurse. Then my interest, I went into maternal child health. And so running a program called Mentorship Program back in the day, which is work with teen moms and kids. And so when I was listening to your club mom and dad, a lot of those things we did back in the early 90s with the mentorship program. And at that time we had what's called neighborhood health professionals, who you call now community health workers. I mean, same name and different name, but the same function. And then helping navigate the system. And so with dealing with the teen moms, again, making sure they had healthy babies and be adequately prepared to be moms. And as you were doing with your program with the club moms and dads, and you have home visitors, that's what we had the neighborhood health professionals helping navigate. And we didn't separate the fathers who were involved with the teen moms were part of the team, as well as the grandmothers. So a lot of times with the teen moms, their mom was a teen when they were born. So when we were teaching the grandparents, we really teaching, I call it then arrested adolescent. So the grandmother was learning right along with the teen mom things that they needed to know that they didn't get as a teenager. So I incorporated in my training to include the whole family. And we go from a strength base, not a negative base kind of thing. So we pull out the strength of the family to empower them to navigate the system. So my rule of thumb is that you teach people how to fish, not feed them. Because when you're gone, they can still eat if you teach them how to fish for themselves. So that's the whole purpose. That was my training in nursing. When you admit a patient, you start your discharge summary right then. So you're learning, you're going to make sure that they're well prepared by the time you leave, so they're not dependent on use. And I guess also get that from my mom, because she has two sisters and we have two brothers, but she taught us to be independent and not to be dependent on her. So you learn how to be self-sufficient. And so I kind of pass that on also as part of training, so that you can take care of yourself. If you can't do it, at least you know how to get the resources to do it. I may be getting off track, but getting back to birth equity, all what you have said this morning, I'm glad I got on in the beginning, is teaching people how to advocate. So moms and teach when I went from working with the Teen Moms program, then the Way to Grow program, working with families. And moms, again, teaching have a healthy body to have a healthy pregnancy and learning how to eat. And so with our home visitors, and we had classes with the mentorship program. Even some of our classes was to teach them how to cook, to teach them how to go to the grocery store and shop. Because a lot of the kids went to the corner grocery store. And when we brought them to a Cub or a bigger grocery store, they didn't know how to navigate to go there because they used to going to the corner grocery store. So these kind of things that what sometimes we take for granted is very new to other people. So you can't assume everybody knows what you know. So you want to start with find out from your clients what they know, and then you build on that. So, and then you try not to come with any preconceived ideas. So again, with training, we talk about sensitivity training, implicit bias. We all have implicit biases. Part of the training that I did back in the day is that each individual had to look at how they perceive people who look different from them. And even because I'm Black, because I go into a Black home, does not know I have the same relationship or same experiences as other Black folks. So I can't assume that their experience is equal mine. And so I have to go learn from them what the experience is so I can help them build and navigate. You don't negate what happened to them, but you help build on what they already know. And so I think that's a really important piece for all of us to work with as healthcare providers, that you don't go in with assumptions and going in with a plan for a family. You want to include them in the plan. You don't come with a plan. And then you have, if a client has more than one provider working with them, sometimes you have to step in and have a consultation. All of them come together to develop one plan. Because as a public health nurse, I found too frequent that the family had 5 different plans to work with, and half the time you'll conflict with them. And so they'll just throw their hands up, and then their resources are saying they're non-compliant. Well, they're non-compliant because you give them impossible tasks to do, instead of making one plan and include them in the planning to make sure that it's a win-win situation for everybody. Again, advocacy that what the panelists said earlier, I think is most important. I think what the one young man, I can't remember exactly how it was said, but my thought is when people are treating you differently, it's a time for you to become the teacher. We all are teachers and students in every situation. So if somebody is treating you that is not correct, let them know that, because otherwise they're going to keep doing the same thing to other people coming behind you. And my thing is you can do it in a nice way and let them know this is where I'm coming from. When you said this is not necessarily true, you're making an assumption. This is not where I'm coming from. Or like the young man said, include me in getting during the birthing and leaving the father out. No, I'm part of this family. I'm supposed to be included in it. You can still say it in a nice way, but this is, like I say, work the program. We have inclusive. Also making birth plans. We developed a birth plan back in the mentorship program that checked out all the stuff. And so how they wanted to have the birth. And so sorry to hear the young lady who she had a birth plan, but they didn't follow it. So hopefully that if you have advocates to work with the family, to make sure that that's happening in the beginning. So to make sure, don't wait till the day of birth to come, here's my birth plan. You let your healthcare provider know in advance. And this is one of the things we did with the mentorship program. They brought their birth plan to their provider with them. And these are the things I want done, making them copies so that they can have it, so that they can't say they didn't know, or you came at the last minute. So that's why you can't provide for you what you wanted. So you want to become mindful and plan ahead. I'm trying to see if I'm touching on all the things that you're doing, but I think put it in the chat that BECC, you guys use those panelists instead of develop a training for a birth center, because I think they need to hear these stories. And also when you're during the training, and I tell it my little soapbox, I stopped during diversity training a long time ago because people don't want to do follow-up. My thing is you have to have follow-up. I don't want to do a break training because a lot of work to do the training. To do 2 hours, they check off and then you go back to work and do the same thing. Nobody wanted to do 3 months, 6 months, 9 months, 12 months follow-up on the staff person that's going to the training to see what changes have been made in themselves on how they're going to treat the client that's coming into the office. If they don't see that they need to make the changes, then it's for naught, because this person is going to still continue the systemic racism, implicit biases that we're seeing, and our health disparity is going to still remain as it is, a big gap instead of closing. There's no reason in the world why we have this health disparities in African American communities with the number of healthcare providers we have in this city. And as the young man said earlier, this is my goal too, I've always seen saying that, if the healthcare provider treats the patient that's in front of them like it was their own mother, sister, brother, cousin, then we wouldn't have this health disparities. Because we know we're going to have the differences. Like the young lady said that her sister was treated different from her. And it shouldn't be a differences. Everybody should be treated as the same. If there's an algorithm, then everybody's treated, no matter what color, skin, nationality you are. I mean, as a public health nurse, I remember making a home visit. I needed an interpreter. Interpreter couldn't come. I still made my home visit, and I do sign language. I mean, the sign language is universal. I mean, I don't know the typical sign language, but we were able to get my point across. And if you're going from heart to heart with a patient, it doesn't matter. You don't need to know the language. It's going to come across in your own body language. And speaking of body language, if stuff coming out your mouth doesn't match what your body language is saying, for people of color especially, I may not know 2 different languages, but I know verbal and nonverbal. And I can read nonverbal really well, being born and raised in New Orleans, because that's a lot of the stuff we had as safety precaution. You check in with the body language. If that doesn't correspond, what's coming out the mouth can say I'm doing every well, good, all that good stuff, but your body language saying no, hold up. That's what I'm going to look at, and that's what I'm going to respond to. So for people, you want to make sure you need to check in with yourself. Am I projecting truly what I'm feeling? Because if you think you are and it's not, people of color are going to know it, and you're going to see it, and you're going to get the reaction from it, and you're not going to know where it's coming from. But it's coming from because they got that intuition on what's going on, what is being transferred to them from you. And it's coming, negative vibes coming in, they're going to expect that they're going to react to the negative vibe. I don't know, how am I doing on time? So, I don't know what else I want to say. I mean, there's so much to say, 10 minutes, I just can't get it all in. But the highlights for me, I mean, verbal and nonverbal communication, look at your own implicit biases, how you're working, and when you're dealing with families, include the whole family. You don't disconnect, and don't separate folks out. If they want to be involved, include them in the planning. Don't go to the homes with a plan for family and they have not put in any input into it. That's not going to work. What else can I tell you? Questions, Amy?
I think you did great, Hazel. Thank you for your wisdom.
Okay.
If there's any questions that come up, please put them in the chat and we'll go over them after all the panelists speak. I will now pass it to Sarah Brown.
Thank you very much. My name is Sarah Brown. My pronouns are she, her, and I'm the Special Projects Manager at Proof Alliance. And I just want to say it is a true honor to be a speaker amongst this incredible group. So thank you very much for having me. Proof Alliance, if you're not familiar, it's a nonprofit focused and committed to preventing alcohol-exposed pregnancies, as well as supporting anyone who's impacted. We do this in a number of ways, including we host an FASD diagnostic clinic. We provide direct support to youth, families, birth moms, adoptive caregivers, kinship caregivers. We share prevention messaging, and we also distribute a number of grants. In the past, we hosted the FASD prevention grant, and through it, organizations in Minnesota could apply for up to $2,500 to host a community event that focused on preconception health, healthy pregnancies, and FASD prevention. So some organizations hosted health fairs, others hosted like awareness fun runs, but one event that kept coming up was community baby showers. And these events really focused on celebrations, celebrating healthy pregnancies, healthy moms, healthy babies, and healthy families. So that's what I will be talking about with my 10 minutes. And community baby showers are really an effective way to share public health messaging and resources. You'll often not only get the pregnant people who attend, but also, their support network, their family, their best friend. So you're able to get your messaging to a wide group of people, and particularly, get their support network on board. And as Hazel was saying, that family-centered care, whether it's chosen family or family by blood, that's going to be really impactful to get them on board. So I know BECC and some of the people who are part of BECC have expressed interest in hosting, community baby showers as a way to share your messaging, your information, your resources. So I was just going to share some examples that our grantees have hosted in the past. Hopefully, inspire you to think of some ideas that might work best in your community. And I will say that each grantee really did think about their unique community when they were planning their events, and that went such a long way. So the first example I wanted to share was from Indian Health Board, which is based here in the Twin Cities. They hosted a community baby shower called Healthy Moms, Healthy Babies. They recruited speakers from the community. The presentations covered things like parenting tips by their care coordinator. They had information on substance use and pregnancy. A certified nurse midwife came. There was a doula who talked about nursing. There was oral health information from Child and Teen Checkup, car safety from Hennepin Health, and others. So they really brought together a wide variety of community speakers and had them share this information. And I'll say that these community partners are really wanting to get this information out there. So I think as you host events, you'll find that most organizations are really excited if you reach out to them and ask them to get involved with your events. Some can do it at no cost, if it's part of their job and they already have funding to share a speaker, that can reduce your costs. But of course, when you can pay speakers, that's always the best option. In addition to the speakers, Indian Health Board had informational resource tables. So after people were done speaking, the attendees could go up and talk, get more information, ask more specific questions that maybe they didn't feel comfortable asking in front of the group. They had a bingo game in which they cleverly incorporated health information. So if you wanted to win, your prize, you had to really be listening and answer some health trivia based on the topics that had been shared during the event. And they also had a Mommy and Me gift bag distribution, and many, if not all of their items were donated. So again, I think there are a lot of organizations, especially if you're in the Twin Cities, but even if you are more rural, your local grocery store, the nonprofits, public health, they often are willing to donate diapers, bottles, toys, onesies. So that's another way to try and be a little bit more cost effective, because I know that cost is one of our big barriers when we're planning events like this. Another thing that really helped in their specific event is that they were able to offer free childcare, which is huge. Not always possible, but if you're able to do it, that really reduces a barrier for families who want to be able to come and pay attention and know their children are with someone safe and trustworthy. The last thing that really stood out about their event and some of the other grantee events was when they formed a planning committee with not only their own staff, but their community partners. So for Indian Health Boards, they had partners like Way to Grow, Hennepin County Public Health, and Division of Indian Work. And they met a few times before the event, and they all were able to give suggestions and guidance and also bring together their networks. So as they were seeking more speakers or more donations, it wasn't just Indian Health Board's network, but now all of these community partners on the planning committee were able to reach out to their folks as well. Another organization who hosted a community baby shower through our grant is Parents in Community Action, or PICA. Are you all familiar with PICA? They offer Head Start, a lot of great social service and support programs. So they hosted a community baby shower and they spent only $550, which is pretty fantastic. And it goes to show that you can host a cost-effective, public health-based community shower. And they actually hosted 2 showers because they have multiple sites. So they hosted one at their McKnight Center and another at Fraser. They primarily invited pregnant folks who are enrolled in their early Head Start, but they also opened it up to the community. So they had a really wide scope of community members who were invited. Their shower had really cute baby shower decorations. They tried to make it feel less of a public health fair, if you will, and more of like, we're here, we're celebrating, it's a baby shower, with the bonus that you'll get some public health messaging, games and prizes. They were able to offer a meal, alcohol-free mocktails, and again, they had a raffle for prizes that had been donated, such as Target gift cards and a pack and play. Similar to the Indian Health Board event, a lot of their games incorporated trivia about preconception and pregnancy health, as well as some questions that were just for fun. And they had a community speaker come in and talk about healthy choices during pregnancy. And many of their community members that they serve are Spanish speakers. So they were able to have someone on staff at both showers to do translations and serve it as interpreter. And I hope I'm okay on time. If not, pull the little cane like they do in the cartoons to get me off. But there was one other baby shower that I wanted to share, and it wasn't our grantee, but it was one that we were invited to share resources at. And it was a really innovative idea because it was a drive-through baby shower. And the reason they hosted it in that aspect is because of the pandemic. They couldn't get a large group of people together, but they still wanted to share the information, the brochures, the diapers, all of these things that they had together. So if folks could drive or walk up, speak briefly to the staff person, and then they'd get a big basket of goodies with information, baby items, things like that. And I think that they even were able to do some deliveries of those packages for people who couldn't get to the space. So that was an additional bonus. And I think hosting the event in that way removed a lot of the costs associated with the traditional shower. You know, you're not renting a space if you need to, you're not providing a big meal, but it still allows you to get a lot of messaging and resources in people's hands. So that's just another idea to keep in mind if you want to host an event like this. I really thought they thought outside the box to make sure they were still serving their community. So overall, when I attend these events and when I talk with the organizers about what made them successful, the key takeaway, I think, was those community partnerships. And I know you all know the importance of that because BECC is a community partnership in its own. But you know, reaching out to your network, expanding your network, getting a lot of people on board is going to make your messaging better. It's going to make your events better, and it's going to mean that more people are served. So if you decide that you're interested in hosting a community baby shower, I just can't undersell, you know, the importance of those partnerships. And I just wanted to say before I end my section, feel free to reach out to me. I'll put my contact information in the chat. And I'm also happy to connect you with the actual organizers of those events because I'm more of a middle person. So I think that's it for me. Thank you so much for letting me speak.
Great. Thank you, Sarah, for sharing those opportunities that the grantees had for hosting community baby showers, as BECC is hoping to host some as well. I will pass it next to LaSherian to introduce her panel for the training.
Yes, so my panel for the training, I have Linda Kopecki from the Minnesota Breastfeeding Coalition and Akmiri Sakira from the Cultural Wellness Center. So we're going to start with Akmiri so she can talk about, um, what they're doing with the perinatal educator training at the Cultural Wellness Center and, what that can do to help out with that because we are going to partner with that. But I'll let Mary talk about it more.
Good morning. Good to see everyone. I'm Akmiri Sakara. I work for the Cultural Wellness Center, and I also am doing some work with Common Sense Childbirth, which is located in Florida. And I am the COPE, which stands for Community Outreach Perinatal Educator Trainer for them. So I'm their national trainer. And so I train people here locally in Minnesota to be a doula, a childbirth educator, and a lactation educator. So when people go through our training, they get all three certifications for that. And so just so that you know, this year I have probably done 7 in-person mask wearing, social distancing trainings, which has been really awesome. So all through the state of Minnesota. And then online, I've probably done about 6 classes, virtual classes online. And so it's been a busy year just looking back at it all and how many people have gone through the trainings. And so, like I said, people are trained to have those 3 certifications, and I'm so excited about this work and being able to talk about it and be able to also talk with other people just about who want to be trainers or who want to do this work here in the cities. It's so important and so needed. I had a quote that I wanted to read about giving birth and being born brings us into the essence of creation, where the human spirit is courageous and bold, and the body a miracle of wisdom, which we see every day. And so, really working with people who are interested in doing this work and doing this work authentically and culturally specific is so important to me, to be able to help people to be able to do that. And also just to check out with people too to make sure that people know that it's more than a notion to be a doula. It's a lot of work, and that you have to do it authentically, and sometimes you might not be thanked, but that's okay. It all comes back around. So it's about reciprocity. And so really working hard with people in the community who are interested. I think going through the training also helps you be able to see whether or not this is the kind of work for you. And so I think that it gives that opportunity too. And so there's many other kind of training programs that are around and that are out there, but I tell you to check out all of them and see what they offer. See if they speak to your spirit and your soul. That's what I really want to be able to say, because they're all different. They offer something different. Um, but I don't know what more I should say, LaSharion, but I appreciate this opportunity. And if you have questions, you can call me. We do have openings virtually. If you want to take one of my virtual classes starting January 3rd, and it's half price. So I can talk to you more about that. You can always message me if you're interested in that. And yeah, so thank you for the opportunity.
Yes, no problem. Yes, because I was talking about how, for the perinatal educator training, we're going to set aside some spots again for Ramsey County participants as well. So, yes, I'm so glad and, happy that, this training is still can happen despite, the pandemic. We're keeping things going. And thank you so much, Akmir, for sharing that with us. Okay, we can pass it to Linda Kopecki from Minnesota Breastfeeding Coalition.
Okay, hi everybody. Linda Kopecki here, and I'm so glad to be following Akmiri. Akmiri Sakura is on our board of directors at the Minnesota Breastfeeding Coalition. So in technical terms, she is one of my bosses at MBC. So really exciting to follow her. And I also have to say that starting this conference out with 2 hours of story sharing and personal experiences is like starting a meal with the richest dessert possible. I have to say, what I have to say, it's probably going to be like the salad course. It's not nearly as exciting. It's probably a little bit of roughage, but not nearly as rich and wonderful as the story sharing. But I have to admit, I prepared some slides, so I'm going to share some slides. I know nobody else did, but I did, so I'll just share them with you. That just helps me with my, kind of keep on track with my timing. So I'm going to talk about training. I'm with the Minnesota Breastfeeding Coalition. I'm the interim executive director. And so when we talk about training, I mean, I'm here talking about lactation, right? Normally we have workshops, and we've been holding virtual workshops since COVID hit. And that includes about 1.5 years ago, a baby behavior workshop where we were able to invite a number of people from Club Mom and from BECC. And so workshops can really provide a few hours of lactation specific training to all types of people, professionals to lactation advocates to folks who work in the community, folks who live in the community. It depends on the topic of the workshop. But these are ongoing ways that we can provide some training. And so input from BECC and from folks in Club Mom and everybody on this conference is really important to determining what types of workshops we can offer and who our speakers are. So any input is most welcome, because we want to make sure that we're responding to the actual needs in the community and not just what we think the needs are. But we're also doing some work to create a more diverse lactation workforce. And LaSherian, you're part of this with the scholarships, and I'll speak more on that. But I want to say this is traditionally what that lactation support in the hospital looks like. It's a couple of white women helping a mom get those twins latched, and just want to say that lactation workforce is a pretty white female group. Still, it was developed by white middle-class women, and that's predominantly who's in there. And I'm going to be talking about the IBCLC, which is International Board Certified Lactation Consultant. It's not the only certification for lactation support, but it's the highest skill level. And really that IBCLC role is that certification that is more likely to be employed by WIC clinics or hospitals. It's more likely to receive reimbursement for services, which we know when a service can be reimbursed, it's more likely to be offered. But I'm just saying, wouldn't it be amazing if it really looked like this? Maybe lactation support could look like this. So this is Rebecca Dunlap. Rebecca is Fond du Lac, Ojibwe. She is finishing her degree in midwifery, and she is a scholarship recipient too, and would like to be an IBCLC, a board certified lactation consultant. And what a difference in lactation support would that be for moms who would love to speak to an African-American lactation consultant, or if they're Hmong, they really want a Hmong lactation consultant, or if they're Native American, it would really make a huge difference, a game changer for them to have an Indigenous lactation consultant. So that's what we're trying to create a system where lactation support looks more like Rebecca and not solely like the image on the left. This is a complicated little slide. This is the formal pathway that the governing body has for achieving that highest level of certification. So there's 3 pathways. We use the word pathway because that's what our governing body uses. 3, so it's pathway 1, pathway 2, pathway 3. You'll see that right over here on the left. And everybody who follows any of those pathways has to have health science prerequisites. So you need to take biology, you need to take nutrition, etc. You need to have some lactation education, so 95 hours of just education in breastfeeding. And then the one on the right, you need to have some clinical mentored hours. So you really need that hands-on experience working with moms that's supervised by somebody who is an IBCLC or it's signed off on. So this yellow pathway is really for those folks who are like healthcare professionals, like Rebecca. So she's doing pathway 1. So she's to be a nurse midwife, and she has those health science prerequisites. And so she's really in that pathway 1. This green one's a pathway 3. LaSharian, I know, is following that pathway. So this is usually for people who are just cobbling together their health science prerequisites or lactation education, and then they get their clinical mentored hours at a hospital or a clinic or at different sites. The middle one, pathway 2, is really a different way. It's actually through a university, and it takes quite a while to set up, but it's like an all-in-one. So the university is the place where you get your health science classes, or maybe you come in with them. They provide the lactation education, and they set you up for those clinical mentored hours. There's only 10 of those in the United States, so very, very few, and there's none of those in Minnesota. So we want to create something new in Minnesota. So we want to take that really complicated set of pathways towards that advanced certification. We want to create something new. So right now we have scholarships, and it was through an anonymous donation. So Rebecca received a scholarship to sit the IBCLC exam. We awarded 5 scholarships this past year. Akamiri and her team on the Equity and Access Subcommittee for MBC were a huge part in, deciding how to structure these scholarships and who to award them to. And LaSharian is a recipient of one of these scholarships as well. So it's really funding for that pathway 1, which is for those healthcare professionals, or pathway 3, which is where you kind of put all the pieces together yourself. We also have a grant through the Bigelow Foundation, and this is like the Ramsey County pilot. And this is funding for a partnership with Ramsey County WIC, and identifying 5 WIC peers who are in a part of a cohort. So they're breastfeeding care counselors. They have lactation training, but may not have those health science prerequisites. And it's connecting them with Regions Hospital and setting up that internship at Regions. And I have to say that that this partnership started at a BECC meeting. So Rochelle Johnson from Regions was at a BECC meeting, and we were talking about lactation, and she said, wait a minute. We want to be a site for an internship. How do we make that possible? So thank you, BECC, for being the birthplace of this project. But that's really supporting that pathway 3. But we also want to design that all-in-one, that university-based model. That's a long-term goal of ours. A third project that we're doing right now is we're partnering with Hennepin County WIC and a similar project. So WIC peer counselors being shepherded through that preparation process. The difference with Hennepin is we're starting with getting the health science prerequisites in Hennepin for the WIC peers. In Ramsey, we're starting with setting up that internship site. But what we want to do is take what we've learned from all those little pieces, the scholarship piece, or we're doing a Ramsey County piece, doing Hennepin County. We want to like make something different. We want to take those ingredients, take what we've learned, and really kind of mix it up and make like, the brownies or something that's a little bit different, but really specific to Minnesota. So what we want to do, our short-term goal, is continue providing scholarships. If you're a nurse or you're a doctor or you're a nurse midwife and you want to be an IBCLC, a check, some money can really help you get on your way. And that may be all you need. Long-term goal is to develop that all-in-one pathway 2, which is university-based, because it's really the easiest way to get through the process. You can get a college degree through that process too. And everybody who's involved, the WIC peers and the people who receive scholarships, are going to be part of designing this. So like LaSherian and Rebecca and others who are part of the current projects are going to be part of designing this. So it's designed from the experiences of BIPOC persons who are going through the process right now. And then there's like a little midterm goal. So we'll use what we learned from the different pilot projects to create a supported pathway 3. So there are people who want to do the, do it on your own time. You collect your health science prerequisites, you find an internship, but we're realizing that it's not a check that's going to help folks in that, using that pathway, but it's money and it's support and it's clarifying the process and it's help finding those health science classes and it's help finding that internship. So it's really a supported process. So just in summary, what we're really looking forward to is a day when more of us have lactation management skills in our tool bags, from moms who really care about lactation and want to learn more to the highest skill level professional.
Thank you so much, Linda, for sharing that and sharing the opportunities that you all are creating and working with community to create. So much appreciated. Okay, I will pass it to Cynthia to lead the policy panel.
Yes, and I do realize that we are, running a little bit behind. So if anybody has any questions for the panelists that have presented as of right now, go ahead and put them in the chat and we will make sure that those questions get addressed in the follow-up email that we send out to the group. If you have questions following the policy session, we actually have a policy work group happening this afternoon, so we can hold on to those questions and address them later on during the day. So as LaSherian and Amber mentioned, the third theme for BECC is the policy piece. And really the community came around after the first goals in 2017 to 2019 in training the Doula for Dads programs. Feedback came back that doula reimbursement and barriers around providing doula birth work were really a big issue. And so for this next 3 years, BECC is really focusing on addressing the barriers that are contributing to doulas to do their best work in community. So today on our panel, we have Debbie Prudhomme from Everyday Miracles, and then we have Rhonda Fellows from Oily Doula and Heather Christine Stroop from Holistic Continuum. And together, Rhonda and Heather have created a local community-aware birth worker doula training program that they will discuss. So Debbie, are you on? Oh, you're on mute.
I'm muted. There we go.
All right.
Maybe next year I'll figure out Zoom. Yeah, I'm pretty thrilled to be with Rhonda and Heather, or Rhonda Heather, however you want to call them. So as Cynthia said, I'm with Everyday Miracles. I've been asked to talk about the barriers with billing, which there are many. I feel like we're lucky in the state of Minnesota that we have that income pathway to bill Medicaid for doula services, but there are so many barriers that need to be taken down. I would say the first one would be the MPI supervisor is a barrier to a lot of people, especially outstate Minnesota. And that's something that BECC is working on, trying to figure out a way that people can bill without having that supervising NPI holder. And I don't know that after I said the big one is the NPI holder, I think evenly is the limited number of training organizations that are listed on the state of Minnesota website. For organizations that are approved to, so if a doula takes her training through a certain organization and runs through all these other hoops, they can bill. It's a very limited number of organizations, it's very white. There needs to be a more diverse group of training organizations. So I can't tell you how thrilled I am that there's this whole group of people working on these issues, because I believe that, many hands will get the work done, and it doesn't just need to be a few people. So getting organizations that have training that was created and taught by people of color, I think is immensely important. There's the cost to being on the doula registry, which is $200 every 3 years. Doesn't sound like a ton of money, but it's a low paying job. So that's another issue. For example, so far this year, Everyday Miracles has put out $6,800 in doula registry fees. You don't really get anything for that, except your name on the list. And then there is the reimbursement rate. It is incredibly low. It's a lot better than it used to be, but it is still way too low for people to make a living wage. So those are the barriers as I see them. Again, I'm thrilled that there's a whole group of people working on this, because I think change can happen. And then I'll get you all caught up on your time, because I don't have much more to say.
Thanks, Debbie. And Debbie's been really strong with us with the BECC team, gathering doulas from across the Twin Cities to really move these issues and work forward with the legislators. And now addressing, we see a lot of light coming in this year, so I'm pretty excited. And up next,
group to be a part of.
And up next, we have Rhonda Fellows and then Heather Christine Strew, and I'll let them introduce themselves. But they are new to us, and we are so excited to have connected with them because they have a really amazing training that is local. That we love supporting our local homegrown, I would say, projects. So I will hand it over to them.
Thank you. I was thinking this morning, I'm so glad I know about BECC. I didn't, if it was ever mentioned to me, I don't remember. And so now I'm like, okay, BECC, what can I learn? And I'm really excited to be a part of this. Again, my name is Rhonda. I'm a birth doula, a childbirth educator. I like to call myself a lactation champion. Love supporting families in that way as well. And I have been working to create a BIPOC birth worker community. And so it's doulas, it's midwives, it's body workers, it's chiropractors, whoever is working, who identifies as BIPOC, who's working with pregnant families. And so as a part of that, I am like doing some behind the scenes work to create community with that and to make it easy for people to find us, because that's what I hear families say all the time. I didn't know there were Black doulas. I didn't know there were Native doulas. Oh, I didn't know I could find a provider of color in this category. So I'm working to build that community as well.
And I'm Heather Christine Struey. My pronouns are she, her. My foundational knowledge is I'm a physical therapist, so I do have a medical background. But I've been a birth doula now for 10 years. Both Rhonda and I are Everyday Miracles doulas, a combined 15 years of doula work for Everyday Miracles. And also I'm a lactation educator counselor. I also do work related to core and pelvic floor. And then Rhonda and I actually met when we became evidence-based childbirth educators about 3 years ago. And it was such a blessing, and and now we have created Community Aware Birth Worker to begin to train new doulas, because there is a definite need for more doulas, and we see the request for doulas come across through Everyday Miracles. And so today we want to talk a little bit about the barriers and how we want to help to advocate for more change and to get more doulas into practice. So with that, we loved the introduction because we do have a local doula training. Both Rhonda and I are active doulas in the community. Luckily, we don't have anyone in their birthing time right now, so we're both able to be here with you today. But we know what's going on in the local hospitals at the present moment, so we can really help our students to know what they can expect when they are in the birthing time. And the stories from this morning were so empowering to know that this is such needed work. And Rhonda, do you want to speak to that?
I mean, no, I'll let us keep going because then we can get started and then we won't run out of time. But well, I can read, like, so what makes our training a little different is, one, we created it. And so local people created the training. And as far as we knew and still know, there weren't any local trainings in the community. We might have local people training doulas, but they're using national or international curriculum, which is great, but we just didn't have anything that was locally grown. And so we definitely consider ourselves to be grassroots. So topics that we talk about, not saying that these are not talked about in other places, but this is on our communityawarebirthworker.com website as well. But, you know, the basics of what is birth support, what does birth look like in different scenarios, the ethics and advocacy parts of the doula work. And one of the things that I was never taught was about doula business. And so helping people know like some of those foundational parts of what do I have to do to be legal with the state if this is going to be my business versus some hobby that I'm doing, right? How do I charge people? How do I do prenatal visits? And what do I do at the birth? What do I do when I go to their homes in the postpartum period? We talk a lot about bias and what does that look like for racial bias, but what does it also look like for LGBTQIA bias, and what's the history of that and how is that still present now? We talk about comfort and coping in different positions, childbirth education, lactation education, and then other hot button topics, because, you know, there's certain things that if you bring it up, it starts a storm. And so helping people understand some of those topics and what our role is as doulas, as well as getting connected in the community. So what are, go ahead, Heather, did you want to add anything to that?
No.
Nope, okay. And thank you for putting that in there, Cynthia. So what are some obstacles and barriers we see? Lots of them, and some of them were already named. Debbie named some. We've heard things actually all day that are barriers. And so some of the things that we have pulled out to talk about would be limited of choices of training options. And that's been mentioned today. And then once you find a training organization, then there's so many layers and hoops that Debbie even mentioned already to get certified in order to be on the registry. And just the idea of certification, honestly, is a patriarchal white supremacist concept. And so, you know, that's important to understand. I'm not saying certification is wrong. Heather and I are both certified through the organization we certified through, but understanding that that doesn't make a good doula, and that should not be defining of the worthiness of a doula, right? And so certification itself is problematic, but also the registry says you have to be certified, and then the organizations that you have to be certified by are either not being taught locally, don't have the same name as they used to when they were put on the registry, or maybe they're not even in business at all. And so that limits our short list even more. And so that's a huge barrier to getting more people trained. So that means you can only be trained by these 2 or 3 or whatever the number is organizations, because those are the only ones on the list that are still active or active in our area. And so the barrier to how do we get, I don't really care if those come off the list. What I care about is how do we get legit local organizations on the list without hoops and dances and all the things just to get onto the list. Like, honestly, it's pretty disgusting, you know, to say, oh, but you local people who are active in the community, and you know what's happening and you're very involved you can't get on the list. Or, well, if you know the secret person, they might be able to get you on the list, you know? And so all of those types of things are barriers to that. And so, and Debbie mentioned this as well, the money at each step. And so how do we break down those barriers and obstacles so more doulas can be trained, and they shouldn't only be able to be trained by 2 or 3 people in a whole state or whatever the number is. I'm just saying 2 or 3. And so we know that postpartum doula training made it on the registry, excuse me, in this past year, which is great because before that we didn't have a local postpartum doula training. But when that one made it on the registry, a barrier and obstacle is no one else was helped in that process. And so that's an obstacle. And the last one I'll say and pass to Heather is the fact that if you can get on the list, can we do it, get on the list in 2022, right? Not have the long period of waiting before you actually eligible, because then you're still not helping the community.
So the question is, how do these barriers affect the community? And we heard that this morning from the stories, right? So a doula's purpose is support, education, and advocacy. And we kept hearing that over and over again in the stories this morning. And with the current limitation on doula trainings, certification, and the registry, those are all barriers to birthing people having a doula and having the doula of their choice. We need to break down these barriers in order to have more doulas, more BIPOC doulas, more LGBTQIA. I said it right, Rhonda. I always move the T up, but I did it correct that time. And it's difficult, it's expensive to be a doula that's eligible to receive Medicaid. Of my backup doulas, I have 5 backup doulas. I'm the only one who has jumped the hoops to make it to the registry because of the time, because they're not financially rewarded to be that doula, even though they would like to be that doula. And the current system doesn't incentivize any blossoming local trainings. It only helps to resource those larger organizations to do the trainings here versus folks like Rhonda and I developing curriculum and putting the time in to educate locally. So these barriers affect the number of doulas out there. And from the stories this morning, we know that that's a huge part of birth and the outcomes too.
And as I was listening to some of those stories this morning, I was like clutching my pearls because I kept thinking about all the things that active doulas who know the system and who know providers behind the scene, which shouldn't be a prerequisite for good care, but it is a thing, right? Or who knows who to call in the hospital right now to get some support. You know, it's like, oh, if they only could have had fill in the blank, I don't know. So that's also part of the barriers is the doulas we do have, what is their knowledge and what do they know in the system? You know, and how do we help train that as well as part of the training? So community aware birth worker, that's who we are. That's just one of the trainings that maybe could go up on the list. You know, we know Nadine Ashby, who is actually at a birth right now and is not here. But they are creating a training as well. You can go to Birth Revolution's website to see that. But maybe there's other people who are starting things, but they don't think it's going to go anywhere. You know, we don't know. But if it was easily accessed by local people who are trained, are active, are professional, maybe we could see how our list could expand to serve the community better. One of the things we talk about in our training, and we've alluded to it, but what are the statistics in the hospitals for different things? You know, how do you find out local statistics? How do you find the provider in the community that is a better fit for you? How do you switch providers in the middle of your pregnancy, at the end of your pregnancy? How do you switch providers in the middle of your birth? You know, like all of that's important. Like as I was listening to their stories, I wondered, did you even know you could kick somebody out the room that works at this birthing location? right? And get a new person. So that type of stuff, you know, we can train and doula trainings, because we need doula training to be more than let's be present and I'll hold your hand and be nice to you. Like, we need that, like, that's not serving our community. With all of the racism and the bias and the prejudice and the abuse and the obstetric violence does not just mean obstetricians. All of that's happening. We have to be training for that in our doula trainings. And then trained versus certified doula. A trained doula means you took a training, like you completed a training. So you went to all parts of it. And at the end of that, you get a certificate that says you're trained. And in all of our hospitals and birthing centers and freestanding birthing centers in the Twin Cities, as long as you have a certificate that says, I took a training and finished it, you can be a doula in that location. Certification is different. So once you're trained, you can decide if you want to be certified by the organization you trained with. And if you say, yes, I want to be certified, then you would follow whatever steps that organization has created. And because doula work is not a regulated industry in this country, there's not like one standard that says, this is how you get trained, this is how you get certified. It's once you pick an organization, you just follow whatever they have said. And a group of us doulas worked really hard in the community during COVID to get the language changed at hospitals to not say you can have one support person and a certified doula. We worked really, really hard to have all hospitals say you can have one support person and a trained professional doula. And it would be great, as Debbie put in the chat, if the registry said trained doula or professional doula and not certified doula. Heather?
That was no, that's yes, that's it all. And we appreciate your time.
Yeah, thanks for inviting us.
Thank you so much. And we will have a chance to go deeper into the doula conversation in our work group later on this afternoon from 2:30 to 3:30. Just being cognizant of time. Like I said, if you had any questions for our panelists, please put them in the chat. We will make sure that we hand them off and get answers for you. And we're going to switch a little bit of the agenda around just because we know it's been a long morning. I don't know about you, I'm hungry. So we're going to take a break now for lunch, and we will come back at 12:40. And then we'll resume with our Ujamaa men's youth, but actually the youth group video, as well as the men's music video, and move on into our afternoon. Okay, so I will see everybody at 12:40. Thank you.